Good day, ladies and gentlemen. Welcome to another episode of Sal's ClassRomm. Previous class we discussed about peptic ulcers, definition, etiology, risk factors, and epidemiology. Please do watch it before this session. Let's continue the discussion of peptic ulcer. Next, we have to discuss about pathophysiology. Our body has a well-defined defense mechanism. It also has a repair mechanism too. This protects our body from foreign particles and microorganisms. The mucus defense and repair mechanisms protect the gastroduodenal mucosa from noxious endogenous and exogenous substances. The mucus defense and repair mechanisms include mucus and bicarbonate secretions, intrinsic epithelial cells defense, and mucosal blood flow. The viscous nature and the near neutral pH of the mucus bicarbonate barrier protect the stomach from the acidic content in the gastric lumen. Apart from mucus and bicarbonate secretion, the body has intrinsic epithelial cell defense and mucosa blood flow. These are responsible for the mucus integrity. The maintenance of mucus integrity and repair is mediated by the production of endogenous prostaglandins. The prostaglandins prevent deep mucosal injury and not superficial damage to individual cells. So actually the pathophysiology comes when there is an imbalance between aggressive factors and protective factors. The aggressive factors are gastric acid and pepsin. The protective factors we have already discussed, those are mucosal defense and repair mechanisms. We have previously discussed about gastric acid secretion. We know it is produced by parietal cells which contain receptors for histamine, gastrin, and acetylcholine. The acid as well as H. pylori infection and NSAID use is an independent factor that contribute to the disruption of mucous integrity. Increased acid secretion has been observed with patients with duodenal ulcer and may be the consequence of H. pylori infection. Patients with Zollinger-Ellison syndrome have profound gastric acid hypersecretion resulting from gastrin-producing tumor. However, when we consider gastric ulcer, they have normal or reduced rate of acid secretion, what we call hypochlorhydria. The total acid secretion is governed by basal, maximal, and meal stimulating acid secretion. The basal acid secretion means a constant rate of acid is secreted from parietal cells, which is responsible for the acidic environment of gastric tract. The maximal acid secretion means the time at which the maximum acid is secreted. When we consume meal, then there is secretion as a result of the meal that we have intaken. This constitutes the meal-stimulated acid secretion. Hence, we can say that the basal, maximal, and meal-stimulated acid secretion varies according to time of the day and the individual's physiological state, age, gender, and health status. The basal acid output follows a circadian rhythm with the highest acid concentration occurring at night and the lowest at the morning. An increase in basal acid output and maximal acid output ratio suggest a basal hypersecretory state which is observed in Zollinger-Ellison syndrome. Pepsin is an important cofactor that play a role in the proteolytic activity involved in ulcer formation. Pepsinogen, the inactive precursor of pepsin, is secreted by the chief cells located in the gastric fundus, which we have discussed previously. Pepsin is activated by acid pH. Optimally, the pH is 1.8 to 3.5. Inactivated reversibly at pH 4 and irreversibly destroyed at pH 7. A study published by Gastroenterology Journal by Stracher et al. Analyzed 4 healthy females for 11 days. They mainly analyzed the influences of acid secretion in various stages of sleep. The EEG report and the eye movement were used to identify the stages of sleep. The acid output was measured by means of intragastric titration. From the study it was found that sleep produced low level of acid secretion. The stages coming from 1 to 4 has no significant differences in acid production. Deeper the sleep, the lesser is the acid production. However, when the person aroused or woke up from night, there was increased amount of acid secretion. This is the reason in which we are having stomach ache when we wake up early in the morning or late at night. What will happen if we are having spicy snacks at that time? The pain would aggravate. So please don't try this practice. Gastric hyperemia and increased prostaglandin synthesis characterize adaptive cytoprotective action, the short-term adaptation of mucosal cells to mild topical irritants. This phenomena enables the stomach to initially withstand the damaging effects of irritants. Alterations in mucosal defense that are induced by H. pylori or NSAIDs are the most important cofactors in the formation of peptic ulcer. Thank you once again. The remaining portions will be discussed soon. Have a nice day.